Oral cancer risk can be lowered or even prevented by simply understanding basic oral hygiene, different bacteria found in the mouth, and how diet influences oral cancers. Currently, research is being done on the relationship between diet and oral cancer. Today, I'll share with you some of this research. I'll begin with some background on the oral cavity. According to the National Cancer Institute, the oral cavity includes the lips, gums, teeth, tongue, lining of the cheeks, salivary glands, floor of the mouth, roof of the mouth, soft palate, uvula, oropharynx, and tonsils. The most common target is the lining of the mouth and is commonly referred to as squamous cell carcinoma. The oral cavity is home to millions of species of microbes. Most of these microbes are beneficial and have specific functions inside the mouth. However, there are some microbes that are harmful. After looking at what the oral cavity is, now let's look at some ways to keep it clean and free from harmful bacteria. According to the American Dental Association, practicing good oral hygiene can help protect your mouth in many ways. These recommendations include brushing twice a day, using a fluoride toothpaste, flossing or using a mouthwash between brushing to limit plaque and enamel loss, replacing toothbrushes every 3 to 4 months or when the bristles begin to fray to prevent gum damage and poor brushing, and yearly dental visits for cleaning and examinations. Usually these visits are when oral cancers are discovered. Good oral hygiene does not seem too hard to follow, but many of us do not follow it very closely. It is easy to skip flossing, forget when to replace a toothbrush, or are just too busy to visit the dentist. When bad oral hygiene is practiced, the mouth is compromised and bacteria take over. One major negative of bad oral hygiene is the development of dental caries or cavities. These include holes or structural damage to the teeth, as seen in the picture on the top right and bottom left. Another negative of bad oral hygiene is gingivitis. This is the inflammation of the gums surrounding the teeth because of plaque left behind after cleaning. Bad oral hygiene also causes halitosis, or what is commonly known as bad breath. Finally, one of the worst results of bad oral hygiene is oral cancer. How many species of bacteria do you think call the oral cavity home? There are over 600 different species of known bacteria in the mouth. Why do these problems of bad oral hygiene occur? It is because of the 600 different known species of microbes in the mouth. Although we know many bacteria that call the oral cavity home, new bacteria are continuing to be discovered. It is estimated that over 100 million microbes are in 1 milliliter of saliva. The majority of the microbes found in the mouth aid in digestion and are harmless. Other bacteria in the mouth utilize the sugars and carbohydrates left, forming acids. As a result, the acids destroy the enamel on the tooth, causing tooth decay, dental caries, gingivitis, and halitosis. 5 different bacteria have been studied and have known functions in the mouth. They include Streptococcus mutans, Pyophoromonas gingivalis, Capnocytophaga gingivalis, Prevotella melanogenica, and Streptococcus mitis. These bacterial species have been found in higher concentrations with certain diseases. Also, Candida albicans, a type of yeast, has been found in the oral cavity and could have a role in oral cancer. The first is Streptococcus mutans, which has been found to cause tooth decay. These bacteria digest the sugars and starches in foods and produce acids, which dissolve tooth enamel. When sucrose is present, plaque formation is increased by this bacteria. Thus, a diet lower in table sugar is better for less plaque formation. The second bacteria has been found to be associated with periodontal or gum disease. High levels found in adult periodontitis lesions, as well as a high pathogenic potential, make this bacteria the main pathogen in periodontal diseases. There are many different strains of this bacteria that are being studied. This is one reason why keeping the oral cavity clean and healthy is important to keep these bacteria from reproducing and forming new strands. 3 other bacteria have also been studied. During a study done to determine the relationship between salivary microbes and oral cancer, these 3 bacteria were found in much higher levels in oral cancer patients than those without oral cancer. The study looked at 40 different bacteria, but these 3 showed signs of the relationship. The increased numbers of these 3 bacteria predicted 80% of oral cancer cases among those tested. As a result, there could be a link between the bacteria in the mouth and cancer occurrence. This technique of measuring the bacteria in the mouth could become a diagnostic indicator of oral cancer. Lastly, Candida albicans is a type of yeast that has been found in the oral cavity. Many of these strains are resistant to antifungal agents. It has been found to be more prevalent in cancer cases rather than healthy mouths. This yeast may invade the oral epithelium and may be involved in oral leukoplakia. Candida leukoplakias have been found to develop in 9 to 40% of oral cancer cases. However, the exact mechanisms by which they work are not fully understood. So what exactly is oral cancer and who is at risk? What are common signs and symptoms? How is it diagnosed and treated? And finally, what are some ways to prevent it? To begin, roughly 30,000 Americans are diagnosed with oral cancer every year. This year alone, there have been 39,400 new cases and 7,900 deaths. There are between 350,000 and 400,000 new cases diagnosed worldwide each year as well. 5-year survival rates for oral cancer are very low, around 54%, because of the difficulty to detect before the cancer has metastasized or spread. Oral cancer kills 1 person every hour, which is greater than the cancers of the cervix, brain, ovary, testes, liver, kidney, malignant melanoma, or Hodgkin's lymphoma. More importantly, incidence in young adults is increasing in both the U.S. and worldwide, so this is a very serious disease. Oral cancers are the 7th most common types of cancer that occur worldwide. The majority are oral squamous cell carcinomas. They consist of cancers that form in the tissues of the oral cavity or the oropharynx. This includes the lips, tongue, cheek linings, hard and soft palates, salivary glands, gums, and throat. 75 to 80% of oral cancers are related to tobacco and/or alcohol use. The remaining oral cancers not caused by tobacco or alcohol are typically caused by plaque surrounding the teeth and gums. There are many different risk factors for oral cancer. African American males suffer the highest incidence and lowest survival rates among any group. The use of tobacco products greatly increases the risk of oral cancer as well as heavy alcohol use. When both are used simultaneously, the risk is 15 times higher. Similarly with other cancers, risk increases with age. Gender plays a role in oral cancer as well. Specifically, men over the age of 40 have a 3 times higher risk at being diagnosed than women. There are many different signs and symptoms to look for during detection. Some of the main ones include sores, lumps, or ulcers in the mouth, pale or discolored tongue, lips, or area around the mouth, painful chewing or swallowing, and swollen lymph nodes in the neck. Many times people will notice a sore mouth but will usually not take it too seriously and just wait for it to go away. During this period of waiting, the cancer may be metastasizing or spreading. Oral cancer cells can spread quickly to surrounding cells. They enter blood vessels or lymph vessels, which branch into all tissues of the body. The cancer cells often appear first in the nearby lymph nodes in the neck. Cancerous cells may attach to other tissues and grow to form new tumors that may damage those tissues as well. For example, if oral cancer spreads to the lungs, it is not treated as oral cancer. It is simply referred to as a metastatic oral cancer and is treated as oral cancer. Diagnosis of oral cancers is difficult. Regular dental or doctor examinations usually discover many oral cancers. Some of the tests used to confirm the diagnosis include a gum or tongue biopsy, as well as X-rays, CT scans, MRIs, or PET scans to determine if the cancer has spread. Whether the cancer is an early cancer or advanced cancer depends on the stage. Early cancers are either stage 1 or 2 and usually consist of a small tumor, smaller than a walnut. Also, no cancer cells are found in the lymph nodes. Advanced cancers have reached stage 3 or 4 and are usually a large tumor as big as a lime. The cancer may have invaded nearby tissues, spread to lymph nodes, or spread to other parts of the body. After the diagnosis is made, a treatment plan can be made. Treatment of oral cancers can include many different techniques. The choice of treatment depends mainly on a person's general health, where in the mouth or throat the cancer began, the size of the tumor, and whether the cancer has spread. For early cancers, surgery is usually done to remove the tumor, but is typically not done if the cancer has spread to the neck. Radiation therapy is also used. Advanced cancers require more treatment. Either chemotherapy, radiation therapy, or a combination of the two is done to target and suppress the tumor. Targeted therapy is a new tool that uses a drug to inhibit the growth of the tumor. It is used in combination with chemotherapy and/or radiation therapy. Speech therapy may also be needed after treatment to improve movement of the mouth and jaw, chewing, swallowing, and speech. Because advanced cancer removal is so invasive, reconstructive surgery may need to be done later as well. Survival rates are typically low because of the damage and spreading the tumor has done. 5-year survival rates are around roughly 50%. However, if the tumor is caught in an early stage, the survival rate goes up to between 80 to 90%. This is a significant increase and shows the importance of early discovery not only for oral cancers but all types of cancer. Oral cancer can be prevented. Most causes of oral cancer we can control. Practicing good oral hygiene helps keep the oral cavity clean and harmful bacteria at bay. Limiting the use of tobacco and alcohol products is another easy way to prevent oral cancer. Many problems with the diet are not related to the actual foods, but bacterial fermentation of the food is the bigger problem. Therefore, consuming a healthy diet with limited snacking, especially on sugary foods, is highly recommended to limit bacteria and plaque growth because of their role in cancer. One study conducted in Italy took place from 1992 to 2005. A total of 804 patients admitted to local hospitals with confirmed oral or pharyngeal cancer were examined. The control group consisted of 2,080 patients admitted to the same hospitals for unrelated reasons. They were then frequency matched for study center location, sex, and 5-year age groups. Each person was given a food frequency questionnaire. 5 major diets were identified, and 29 macronutrients and micronutrients were examined. The diets consisted of an animal product diet, starch-rich, vitamins and fiber, unsaturated fats, and retinol and niacin. Results from the study showed a positive association between animal products and oral cancer. The starch-rich diet had no significant risk. The diets containing vitamins and fiber and saturated fats were inversely associated with oral cancer. This study concluded that a diet rich in fruits, vegetables, cereals, and olive oil had protective effects against oral cancer. This protective diet is very similar to the Mediterranean diet, which is based on high fruits, vegetables, cereals, olive oil, wine, and low in meats and dairy products. Another study performed a meta-analysis of studies done up until 2008. Different food groups were examined to find relationships with oral cancers. The food groups included fruits and vegetables, cereals, meat, fish, and eggs, milk and dairy products, macronutrients, micronutrients, coffee, tea, and flavonoids. Results from the meta-analysis showed an inverse association between fruit and vegetables and oral cancer. In a network of studies from Italy, 20 to 25% of oral cancers were related to low fruit and vegetable consumption. Fish also showed an inverse association with oral cancer occurrence. The more refined cereals are, may have an increased association with oral cancers. In many studies, meat is related to an increased risk of oral cancers. This can be attributed to the fat and cholesterol content, so meat should be consumed modestly. No significant relationship was found between milk, dairy products, coffee, or tea. Now take a minute to think about which foods increase risk or reduce risk for oral cancer. Which column should the burger go under? Increases risk. Which column should the orange go under? Reduces risk. Which column should the broccoli go under? Reduces risk. Which column should the strawberries go under? Reduces risk. Which column should the white bread go under? Increases risk. Which column should the raspberries go under? Reduces risk. And finally, which column should the steak go under? Increases risk. Oral cancer is a very serious disease that can be prevented. Practicing good oral hygiene is key to help keep the oral cavity clean. Limiting the use of tobacco and alcohol products is also important because these are the causes of most oral cancers. Lastly, eating a well-balanced diet that has protective effects can reduce the risk of oral cancer. This includes a diet high in fruits, vegetables, and fish, and low in high-fat and cholesterol meats, rice, and refined grains. For more information on oral hygiene and oral cancer, these are a few good websites to take a look at.